It's okay. Good afternoon, everyone. Thank you so much for being here and joining us today. I'm honored to be here with our council members and many other honored guests. Councilman at Large Division B Scott Walker, Councilman Dino Bonanno from District 2, Councilman Byron Lee. Oh, I'm sorry, Councilwoman Councilman Dominic Impastato and Councilwoman Jennifer Van Rankin, along with Louisiana Department of Health, our Region 1 Medical Director, Dr. Joseph Cantor, our Coroner, Dr. Jerry Satanovich, Sheriff Joe Lapinto, our School Superintendent, Kate Brumley, JEDCO, from JEDCO, Jerry Bologna, from our Chamber of Commerce, Todd Murphy, and our Emergency Management Director, Mr. Joe Valiente. The case numbers today, as we move forward, 5,346 cases for Jefferson Parish, unfortunately with 261 deaths. So as we see, we still rise. We still have to see these tallies every day, which are very, very difficult for us. I do want to say that we're still top of the country, even though we have gains and even though there's indications that we're reaching a plateau, we're still top of the country. We were the top third state. Louisiana was after New York and New Jersey 3 weeks ago in deaths and in cases. So 3 weeks ago, you look at 76 positives per 1,000 people on cases, 3 deaths per 100,000 people. As we move forward and as the tallies increase, we still are, even though it grows, we're still at the top of the chain with Louisiana leading the country, 485 cases per 100,000 people and 25 deaths per 100,000 people. So don't let that get lost on you that the greater New Orleans area's rates are even beyond that, because we know we're a hot spot in Louisiana. So we are a community that's grieving. We have sadness throughout our community. We all know people who are sick, or we know families who have lost loved ones. So we read the data and we say the numbers and we look at the numbers every day to see how we are and to see our standing and to see where we are in the curve. Not forgetting that we are a community that is suffering on many, many fronts with sadness all around. It's critical as of today, and it's critical for the near future, that we are still at a stay-at-home order. The current scoreboard, and there's a unicast social distancing scoreboard, gives Jefferson Parish a D+. So we have a lot of improving to do still. And again, we'll reiterate every time, any positives that we see coming forward and in the future are only because we are still very strict with our social distancing and only going out for essentials. And I realize that Jefferson Parish, we're very blessed. We have a lot of essential stores, and I realize there is going to be activity and movement to get your essentials, but I really want to impress on everyone, don't go on as many trips as you need to do. Think ahead, plan ahead, and don't go as many times during the week. The good news is, and we have Dr. Cantor here who will go into more detail on this, the drop in hospitalization numbers. There's a drop in ventilator use. Those are all wonderful things that we were hoping to see one day, that we've passed that medical capacity peak. All great news for us, even though we are still very much in the midst of this. We stand here in front of the Yenny building, which is our East Bank location, as an employer as well. We have our employees suffering, but we still have 40 departments that are still working. But again, we have employees who are sick. We have employees who have lost people. And so, I just want to thank them for their public service, because all of us are working the front line of this, especially, and I'll say it again, the medical community, but even in government, we have employees that we know the role that we play in government to be stable for our community at this time, and it's a call that we have willingly taken on. It's our public service call, and I think all of us are proud, very proud to do that, including everyone here with me today. So we know this is our time to serve, and we are happy to answer that call. I'm going to invite Mr. Joe Valiente up here later on to go over the Alario Center testing site that we took over from the federal government. I do want to thank everyone. A couple weeks ago, the CDC recommended that we go out and we do our shopping and we do our essentials and cover ourselves with masks. The homemade masks are an incredible use for that purpose. It's an appropriate use for that kind of mask. It protects other people from your own respiratory droplets. And I know there is an army of seamstresses who are making incredible masks, and we encourage them, if there's any extra, to please drop it off at our library sites on the East Bank and the West Bank, the book drops that we have. I want to personally thank Miss Lem Wynn, warden. I don't know her, but she made over 40 masks, 46 masks, put it in a Ziploc bag, put her name on it. I wish I had her address to contact her. I think we found her on social media. But incredible that we'll put those masks to good use. So I know all those seamstresses, please, we will take your donations. We've also been very blessed with additional donations. The Taiwanese Chamber of Commerce, through the Zuchi Charity Foundation, just donated 10,000 masks to us the other day. The Chinese American Association also donated 6,400 masks. So the community is good, and the community is sharing, and we certainly appreciate that. I have Dr. Brumley here with us later, and I know he has some news given the governor's orders, and I've never really talked about this before, but I do want to do a special mention. You know, we always come up here and we talk about losses that we have, and I've always thought of the losses in two ways: the medical side, the positive cases, and the deaths. And I've always seen it on the financial side. There's so much financial suffering, people with lost jobs, business owners trying to survive, wondering what the future looks like. And we have our business leaders here to go into more detail. But there are so many other losses too that we're all having to deal with as a community, which makes it really an emotional struggle for us. And lately I've really been thinking about the senior class of 2020. This is the time of the year where you would be starting those special events that you would be celebrating in your school, the lunches and the special rallies to celebrate seniors leading up to graduation day. I know right now is that time that you're missing. You're missing your college admission tours. You don't know when college will start. You don't know if when you're gonna graduate. It's a tough time, and it's a loss as well. It's a different kind of loss than the other losses we talk about in the community, but it is a loss just the same. You deserve the celebration. You deserve the milestone. It's your rite of passage. It's a rite of passage that generations before you have enjoyed. And I want you to know that we feel for you. Certainly, I'm a parent, as an adult. We're so used to trying to guide the way for you and lead the path and explain the mistakes that we've made so you don't make them, and that never works generation to generation. But it's hard for us. It's hard for me as an adult. It's hard for me as a parent. It's hard for me as an elected official to not know the certainty to deliver to you. I know it's a struggle, and I know it's difficult to see it now. But I'm very certain that the friendships that you have and going through this distress together is only going to make you closer as a class. I think incredible things are going to happen with your generation, that you go through this extreme stressful situation in such an extreme way. It's going to lead to generational changes for the good of me when I get to be a much older person. So I look forward to seeing that, and I look forward to a special kind of celebration for our senior class. And I know Dr. Brumley misses his students, and he will go more into that. I know there have been many questions about the stay-at-home order and whether Jefferson Parish is going to extend that order. Right now, our stay-at-home order is until April 30th. We had an incredible meeting through our council members, with our business leaders, JEDCO, the Chamber, G&O Inc. This is going to be data-driven. It's going to be a process where we're going to really look to our medical community, to our business community, to our elected officials, to the governor's office, to our surrounding parishes, to step carefully when we go about. It's not going to be a big old jump in. It's going to be treading carefully, getting advice from our medical community as to how to constantly reassess what we're doing, making sure there's proper testing, making sure there's proper monitoring, that we're quarantining individuals, that when we reopen industry, that it's done with thought and purpose. And so I look forward to those discussions ramping up in the next days and the next weeks, and we will give you more information as that goes on. But rest assured, those discussions are absolutely happening now. And are very much engaged in that process. We all look forward to the day when we can start resuming getting our community back to the way it is. And it is going to be a step-by-step process that I think all of us should be committed to. And with that, I just want to, I know our council members have been so much on the forefront of this with food distribution and all of those things, so some of them might want to speak later about that, but I want to push, again, at the end, consider a donation to Second Harvest Food Bank, consider a donation of blood to to get out from at home and feeling like you're not part of this, that you are part of that, and you can donate, and every little bit makes a difference. I want to reiterate that our government is open. All of our departments are active. We can be reached by phone, we can be reached by email, and also by appointments as well. And with that, again, stay in touch with us, jeffparish.net. Text JP Alert to 888-777, and also on Facebook, Instagram, and Twitter. So I would like to next call up next. The order that we have been looking at this is the medical community next. So we've always been blessed to have Dr. Cantor, Dr. Joseph Cantor, who's the Medical One Regional Director from the state, be with us here. And then I would like to call up Dr. Jerry Satanovich after that. So Dr. Cantor.
Thank you, Madam President, and thank you for the continued leadership that you've shown on this issue. I wanted to share some good news and some not so good news with everyone today. The good news is that there is evidence that everyone's effort to stay at home and distance themselves has paid off, because what we're seeing now is a beginning of the curve flattening. This is what we were trying to do the whole time, and avoid a big spike in patients coming into the hospital that would overwhelm the system and cause a lot more loss of life that would have been unnecessary. And because of the efforts of everyone in the community, we're now beginning to see this curve flatten. So for example, at the moment in the greater New Orleans region, all 4 parishes, there are 186 individuals with COVID or with a test pending who are on ventilators. This time, 2 weeks ago, we were projecting that number to be 1,000. There are about 1,000 people hospitalized in the region with COVID or a test pending, and a couple of weeks ago, we were projecting that number to be 3,000. And you look at the Montreal Convention Center, which is a regional asset, there's just over 100 patients there right now, and we had scoped that out to thousands. That's incredible news. That means that we were able to decrease the spike and preserve acute health care for people that need it. We're very thankful for that, and we're very thankful for people out there in the community heeding the orders, heeding the advice of President Lee Sheng, and staying home to help stop that spread. The bad news that I'll share is there are concerns that people are letting up a little bit. And listening to reports from the state police, for example, or the cell phone monitoring data that the president mentioned, we feel that over the past few days, Easter weekend and going forward, people have become less vigilant. And that's a real cause for concern. I'll tell you, in my off time, I'm a practicing ER doctor, and I actually worked a couple days ago at night. And in the trauma center, we were seeing the old traumas and accidents that we hadn't seen for a while happen again. And it was concerning because it was indicative that people are out and about, driving on the roads, leaving their home, and we don't want to see that happen. One of the things about this outbreak is there's a lag in the metrics that we see. So when we see cases added to the case count, or people in hospital beds, or ventilated patients, or even deaths, that's like 2 or 3 weeks out from when that individual was exposed to the virus. So we won't know what the effect of Easter weekend was, or the past couple of days was, until a week or 2 down the road. But we can expect to see a little bit of a bump, and that's really concerning, because even though we have bent the curve and we're plateauing right now, it's a very high plateau. There's still a lot of virus out in the community. There's still a lot of risk out there. And there's likely going to be that for some time. So until we figure out a good evidence-based way to reopen the community, we need people to remain vigilant. I'm glad the parish president mentioned masks. I have mine that I keep with me all the time. And whenever folks go into a potentially close quarters setting like a grocery store, a bank or something, anywhere where they're not going to be able to be distanced a good amount from folks, it really is important to protect everyone around them by wearing a mask. And I think we just need to continue to be vigilant until we get a good plan of how we're going to reopen. That plan's going to come soon, but until we get there, I think it's not yet time to let up. I don't want people to be exposed unnecessarily. And then I'll just end by kind of how we always end, which is recognizing and thanking the folks who are working on the front lines, the healthcare workers who are working hard and kind of putting themselves out to help others. And there's a lot of good ways folks can support them. You can just call or text someone who you know that works in a hospital and let them know that you're thinking about them and you're proud of them. That goes a long way. And there's some organizations who are helping to supply food for healthcare workers. Feed the Front Lines NOLA is one of those, and that goes a long way too. So thank everyone.
Good afternoon. I'm Dr. Jerry Satanovich. I'm the coroner. Unfortunately, I don't have quite as fashionable a mask as President Sheng and Dr. Cantor. I want to talk about our death rate, and specifically, I've gotten a lot of questions in the last day about a report yesterday regarding the number of deaths in our parish, and it was reported that there's a discrepancy between what we're reporting and what the state's reporting. And there's nothing underhanded going on there, and it's because when we report a death, the state has a very meticulous process that they have to go through to ensure, dot the I's, cross the T's, cross-reference where the patient's living. There's a whole lot they need to do before they report it to the media. So there is a lag there. As a matter of fact, if we didn't have a death for the next 5 to 7 days, the state would still be reporting about 25 deaths from Jefferson Parish. So, and it seems like you've heard some good news already about the curve being bent, the number of ICU patients going down. Yet it seems like we still see lots of numbers of folks dying from this. And I want to just remind what Dr. Cantor said. They say from when somebody seeks medical care to when they die, it's an average of 11 days. And remember, they were infected anywhere from 4 to 14 days before that. So people who are dying today or yesterday, actually got sick about 3 weeks ago. So I always worry that people misinterpret the good work that they're doing with the social distancing. Thank you very much. Not sure who's next.
Thank you. I'd like to next invite Sheriff Joe Lopinto.
Thank you, Madam President. Just a little update on the Sheriff's Office itself. I've previously released numbers from the Sheriff's Office employees. Currently, we have about 80 of our employees that have tested positive over the last few weeks. Out of that 80, many of them have come back, and we've had some really good news in this past week. We all know about the passing of Sergeant Out West, on which we did the memorial yesterday for, but we had up to about 8 people in the hospital one period of time. Right now, we're down to 1. Who was on the ventilator, is now pulled off of that ventilator and trying to recover still from the disease. So we've had some good news on the Sheriff's Office. We've taken steps this week and next week in order to be able to recover. We know we're going to open back up for business on our non-essential personnel that is currently home. So we're taking the steps to make sure that we can do whatever we can for when the public has to show back up. For the services that are open in the Sheriff's Office, they'll be able to do so, and we'll be able to handle their needs. With that, y'all, I'll take any questions afterwards. Thank you.
Okay, and certainly with the governor's announcement that school campuses would be closed for the rest of the year, I know Dr. Brumley has some updates to give. So our superintendent of the Jefferson Parish Schools, Dr. Cade Brumley.
So as you know, the governor canceled school in terms of being in a building for the remainder of the year, but what we know is that school is much more than a building. School is a family, school is a community, and it's who we are, it's who we are becoming. And so for us in Jefferson Parish, we will continue a continuity of learning even though our buildings are closed. With that, we want to encourage families who have a device and internet access to go to jpschools.org, and there you will be able to find a host of resources available for your students. If you do not have technology, a device, or internet, we do offer paper-based packets. We'll be offering those again at the end of this month at all of our 13 grab-and-go lunch sites. So far, we've served well over 150,000 meals to students curbside. That will continue through the remainder of our school year, which ends on May the 21st. One important announcement relative to student learning On Monday, we will begin a Chromebook loaner program for families who do not have a device. We've also been working with internet providers to get low-cost internet service for our families. So you'll see more information about that coming out soon. Families, if you do not have a computer device and you would like to participate in at-home learning through our website, beginning Monday, you can make contact with your schools and secure a device to have instruction there at home. One of the most significant announcements we're announcing today is just the fact that we are moving our graduation ceremonies from May, when they were scheduled to take place, to July. It's our hope that we can give our class of 2020 a traditional graduation. We obviously don't know if that will be the case in July, but right now we are planning to do that. So basically the second week of July, we'll be beginning graduations at the Pontchartrain Center. And I want to just read that schedule to you quickly. It will also be available at jpschools.org. July 6th, Riverdale High at 9:30 a.m., Haynes Academy at 2 p.m., East Jefferson High School at 6 p.m. July 7th, West Jefferson High at 9:30 a.m., Thomas Jefferson Academy at 2 p.m., Grace Keene High School at 6 p.m. July 8th, Higgins High School at 9:30 a.m., Patrick Taylor Academy at 2 p.m., Helen Cox High School at 6 p.m. July the 9th, John Ehret High School, 9:30 a.m., Fisher High School, 2 p.m., Bonneville High School, 6 p.m. July 10th, Grand Isle High School will hold their graduation at their school at 12 p.m. July 14th, JCFA High School will hold their graduation at La Maison Creole at 6:30 p.m. And we will soon release information regarding Kinder Discovery High School's graduation. If we are unable to congregate for in-person graduations, I want to go ahead and let everyone know that our intent will be in mid-July or late July to hold virtual graduations for our students. Our seniors deserve a traditional graduation, and we hope that we're able to give that to them, but at the same time, we recognize that may not be possible. If that's not possible, we will do virtual graduation at the end of July. Thank you.
Thank you. We've always been so fortunate to have a strong business community here, and I want to invite Mr. Jerry Bologna from JEDCO and also Mr. Todd Murphy from the Jefferson Chamber of Commerce up to speak next.
Thank you, President Lee Sheng. I want to thank you for your leadership and the leadership of the Jefferson Parish Council. This group has been hyper-focused not only on the health, safety, and well-being of our community from a medical standpoint, but also in taking a pragmatic approach to restarting this economy when the time is right. On behalf of the Jefferson Economic Development Commission, the Jefferson Chamber, and the Jefferson Business Council, our role right now is twofold. First, we continue to be a resource provider for our businesses, and we thank those businesses for their patience as some of these federal programs have rolled out. It's been well documented this morning that the PPP program has run out of funding. The banks locally are no longer taking applications. Our organizations, unified with our regional partners and our state partners, are advocating for additional funding for those programs to ensure that our businesses get that much needed funding. On a parallel track, our group held the first call today with members of the Parish Council, the administration, and our medical community to start the discussion of forming that reentry program, or that coming back to business program that we call Back to Business in Jefferson. We will begin prioritizing those industries, putting that plan together, and in addition to prioritizing industries, coming out with industry guidance for each of those industries and recommendations that they can follow as we start to restage our economy. And we look forward to doing that in partnership with our regional partners throughout the area. So that's our update for right now. And Todd, I don't know if you want to add something from the chamber perspective.
Thank you, Jerry. Just to reiterate what Jerry said, we are working with our local, state, and congressional delegation on those loan programs to release more funds. You can find that information, resource information at jetco.org or at jeffersonchamber.org. All the loan information is there, and again, we're working to secure more funds to flush out. I guess the main point that I would like to just reiterate is that we are working as a team, and if you do business in Jefferson Parish, not just if you're located here, but if you do business here, you know by now that we do things uniquely different. We work as a team, we collaborate, we communicate on a regular basis, and we know that it's important to have a healthy community. We also know it's important to bring our healthy economy back, and we're going to do that just as soon as we can. So part of my message is be patient. I know you're tired of hearing that, but the other side is keep the confidence that you have in the elected officials behind me, in the business community, in our healthcare community. We're not perfect, but I think we've always done things the right way, and we're going to continue to do that to rebuild our economy. Thank you.
Thank you so much. Before we invite our council members up, I would like to invite Mr. Joe Valiente, who is our Emergency Management Director, because there have been some behind-the-scenes changes at our Ilario Center. So, Mr. Valiente?
Thank you, Madam President. So I want to remind everyone that the Ilario Center drive-through testing site is still operational. The hours are 8 a.m. to 1 p.m. and you do not have to have any symptoms to qualify for a test. And the next point that I want to make is that the nature of the test, we now have a short swab test, which is a self-test. So the National Guard personnel will instruct you how to take the packet apart, label it, and then the swab itself is not nearly as invasive as the original test, and you simply swab the inside of your nose about a ½ an inch on both sides for about 15 seconds, place it in a tube, close it, goes back on the table, and then we process that. So the other thing is that we will be taking over the call center on Monday, and Jefferson Parish will support that out of the EOC, and we're hoping that that will decrease the amount of time that it takes for individuals who are tested to get their results back. The last thing that I want to mention is I want to thank everybody that's been supporting us at that site. The Louisiana National Guard, West Bank volunteer firefighters under Brian Adams have done a phenomenal job. Parks and Recreation, General Services, the Ilario Center staff, JPSO, as far as the security and traffic control is concerned, and without their support, that site would not be nearly as successful. So I just want to thank them. That's all.
Thank you, and I've said this many times before, our council members are on the front line of this issue. We speak daily, and many of them have, individual projects they're working on. They are going to really be heavily involved in how we ramp up, again, with our business community, because they really know a lot of businesses. They are really have their ear to the ground on what needs to happen and any adjustments that we have to make. So we will really be relying on their leadership, especially so in the next couple weeks. So with that, I want to invite any of our council members here to speak. I will start off with our councilman at large, Mr. Scott Walker, and then any other council members who would also like to take the podium. Thank you.
Thank you, Madam President. And nobody's shown a mask in a few speakers, so I'll show you my Saints mask that my mom made for me. So shout out to Judy Walker. She will not make thousands of these, but she was trying to help, and a lot of people right now, as we know, are trying to help. We will echo that, and we have been echoing that through our council offices. I'll tell you that I'm inspired by the leadership around me up here. I've only been around a short time, since January, and things change very quickly after what we thought was going to be normal for a while transpired. We are all here to help. We are all a resource for you. There are various initiatives started by different council offices that, in the interest of time, I won't mention all of them. I won't even mention my own, but you can go to the Facebook page of each of us and see what we're doing. We are information pushers. We know you want information, and you want it quickly, and you want it in real time, and we're all doing our very best to get that word out there and get you all the information that we have as soon as humanly possible. So thank you for using us as a resource as a council at large. I keep an eye on the whole parish. I think we've heard from the whole parish in my office over the past 5 weeks. We continue to listen. We continue to respond to COVID-related issues and streetlight issues, garbage issues, things like that. Your normal issues, we're still here and we're still responding to those as well. Thank you once again, echoing what everybody else has said, to our healthcare workers, our fire, police, EMS, everybody who's working in grocery stores, and anybody who's in an essential operation that is here for the people of Jefferson Parish. Thank you very much. And we add now our bankers to the front lines of this, because they have been in a mountain of paperwork and deluged by the government plans that have been released and have since run out of money, and hopefully there'll be more money so they can work hard for us all again. So thank you to everybody in Jefferson Parish, and thank you all for being here. Continue to get our word out. Thank you.
Good afternoon. I'm Dino Bonanno, Councilman for Jefferson Parish District 2. First of all, I just want to echo a lot of the remarks that were made earlier, thanking all our first responders, certainly our medical staff in our hospitals, our firefighters, our police, our EMTs, but especially the Louisiana National Guard. As a first responder, I've worked side by side with these soldiers for a long time, but they have really stepped up in this event. They're doing everything from testing presumptive positive patients to working at the Second Harvest Food Bank, preparing meals and boxing groceries. They've been a fabulous resource to this parish, and we owe them a debt of gratitude. I think it's important for the citizens of this parish to know that your parish government is currently working on a recovery plan for when this parish is ready to reopen. We're not sitting around waiting to develop those ideas. We've been working in concert with our business community, our schools, and our medical staff to put together a plan that is smart but still maintains the necessary procedures to ensure that the curve continues to fall. So we're going to be doing that over the next couple of weeks. You'll be hearing more from us about that. But that is an initiative that's ongoing right now in this parish, and y'all need to know that we're doing that and that we're not waiting. Thank you.
I'm Councilwoman Jennifer Van Vranken. I represent the Metairie area. One of the things, and I think we've hit on this multiple times, but I want to emphasize, we are you. And the people that you see in our parish government, my colleagues on the council, our parish president, we are immersed in small business and have grown up uniquely around small business. I remember my first job as a little kid was learning to make finger sandwiches, propped up on a step stool with Miss Gertrude in the kitchen. We have a reception business to this day. Our parish president comes from the heritage of the House of Lee, a renowned Metairie restaurant. Scott Walker has currently a donut shop. I know Councilman Impastato, his dad is an excellent chef, had Dominic's Restaurant. So my point is, we understand. We are not looking at this solely as government and our responsibilities there, but we are from a heritage of small business. That is what makes Jefferson Parish special. So we understand going from a successful business to all of a sudden zero income, in many cases, overnight. We appreciate that, and that's why we each feel a sense of urgency in starting now to plan, how do we come back from this? Which businesses are first? How do we phase you in? What will you have to do when you open your doors that will be different than we used to know as normal? So again, we are doing that legwork. We feel the urgency. Please know that we are working to bring as quickly as we can our small business community and all of our businesses back. Thank you.
Dominic Impastato, I represent District 4 in Jefferson Parish. Today is April 16th. Right now, the stay-at-home order is 2 more weeks. Now, as Parish President Lee Sheng said, we're hopeful that at that point, things can change and we can start moving back to business as usual. That's the goal. No one can promise that. No one can guarantee that. But the reality is, the measures that have been taken, the stay-at-home orders, the social distancing, all those measures, we've seen the improvement in the numbers. What we need as your elected officials, we need 2 more weeks of vigilance and work to make sure that in 2 weeks we can make the case to the federal government, to the state, to the governor, to everyone up and down the line that Jefferson Parish is ready to be back reopened for business. We want to make that case. That's the case that all of your elected officials up here are telling you we are preparing to make as we speak. We are taking the measures so that Jefferson Parish will be ready to start phasing back in and be back to business. But we need your help. Give us these next 2 weeks so the data will come back, as Parish President Lee Sheng said, that allows us to make that case and get this order moving in a positive direction. Thank you.
Thank you, Councilman Impastato. We can open it for questions. Yes.
Is there concern that Jefferson Parish numbers are starting to line up with New Orleans numbers?
Yes. Dr. Cantor, do you want to speak about that? But yes, certainly in the last couple days, we have crept up closer. I think the amounts now are like 89, 90% of the New Orleans figures, both on the positives and the death count. Did you want to speak about that, Dr. Cantor, or no? Yeah. Huh?
And then one more question for you.
Yes. And that wasn't always the case, you know, and I would look at the numbers before, it was about 70, 75%. I mean, it would change, but yes, in the past week, past 5 days, we really jumped up closer to the New Orleans numbers. Yes.
Do you think that's due to a backlog in the testing results, or what do you attribute that to?
I don't know. You know, if I would have taken a guess at the beginning, I would have thought that the number stayed consistent so long, that ratio of the difference. I really couldn't. Maybe somebody from the medical community could take a stab at that, but it was surprising to us as well. Yes.
Yeah, it's a good question, and it's actually being seen across the state now. So right now, the region here, the Region 1, which is the 4-parish area, accounts for about 51% of both cases and deaths statewide. And 2 weeks ago, that was up closer to 66%. So the rest of the state is kind of catching up to where this region was earlier. You know, it's difficult to like the parish boundaries don't stop COVID. So it's important to think of Jefferson Parish and Orleans really regionally. And, you know, for example, the very first case that we had in Louisiana, which was a month and 4 days ago today, was an individual who resided in Jeff Parish but worked in Orleans. So, you know, the boundaries are somewhat less important like that. I will say that the numbers ebb and flow a little bit. And a few days ago, we saw a large increase in the number of tests that were performed in Jefferson Parish. And that it was just an issue with how they were being attributed. There was one of the hospitals was logging tests under an Orleans address when it was actually being done in Jefferson Parish. And the testing site was actually going to Orleans as well. So it was a correction to tests that were being mislabeled. The way that we report the numbers is tests performed are reported according to the location of where that test was conducted. Actual cases are reported and deaths are reported according to the residence of that individual. But I think you're going to see this continue to be a regional issue, and the rest of the state continue to go up a little bit, just relatively speaking.
One follow-up for Parish President real quick. Oh, okay. I'm sorry. Go ahead.
I want to answer that as well, that same question. You know, the number of deaths, you know, that we're seeing, you know, from this, there were people early on that weren't tested, but they died from COVID. And it was like, for example, somebody in a nursing home whose neighbors on either side had COVID. They had COVID symptoms, but maybe had a directive that said they didn't want to go to the hospital. They died at the nursing home. Initially, the state wasn't really allowing us to report those as COVID because there was no positive tests. So I think about a week and a half, 2 weeks ago, the CDC came out with a directive that you could list COVID on these obvious cases that have been investigated by professionals and list them as COVID. In Jefferson, we started reporting those at that point. And I'm not sure if other parishes have done that yet. I know I've shared that information with other parishes, but that may be an explanation for why we have kind of, as you would say, caught up.
Just one quick follow-up, Madam President. Your stay-at-home order continues until April 30th. Can you tell us why you've decided not to extend it, or if you have plans to extend it, and the reasons behind that?
So the question is about the stay-at-home order, and it now expires on April 30th. If you see the people here with us right now, it's a representation of the entire community. We have elected officials, we have the business community, the school system, the law enforcement, all of us. That's not just for the press conference, that's for on a daily basis as well. So we all communicate very well. So I see this as certainly getting the nod and the go-ahead. Certainly it has to come from the medical community first. That, you know, and we can see what the data looks like. I would hope that every day from now on, we have completely falling daily case counts. And if that's the case, as Councilman Impastato was saying, I think we can really make a strong case to start taking steps to getting back to normal, taking steps, right, on May 1st. I think that's completely appropriate, but of course we would have to consult with the medical community, and I think we would all be on board with that. If it goes up and down until then, or God forbid if it increases, we're in a completely different ballgame, right? So I think we have some time to make that decision, and I think we're all talking a lot. And certainly, as our council members are saying, and the business community is saying, it's going to take some time. We're all going to get planned, ready to be able to pull the trigger and make those steps when we can do it. When the medical community says, I think it's safe. We're not going to be able to have non-existent virus before we do that. We know that the virus is going to live with us for a long time. The only thing that we're trying to prevent is a resurgence of this, and that goes hand in hand with the business community. Nobody wants that. The business community doesn't want that either, because the economic suffering is just, you get a short-term satisfaction in thinking we're starting to get back, and 2 weeks later you find, we really made a mistake. The business community does not want that either. That would be, disastrous for the business community. So we understand the delicate nature of it. We understand there's a lot of pieces to it. And, but again, we're going to be ready for when the data shows that we as a community are ready to do this.
I have a question for Mr. Satanovich. Earlier today...
I'm sorry, without your mask, with your mask on, I can't even see you speaking to me. Okay, yes, got it.
Okay. So, Mr. Satanovich, earlier today, some elected leaders from the West Bank were saying there's a disproportionate number of deaths among African Americans on the West Bank. Can you speak to coronavirus deaths specifically in that area of Jefferson Parish?
Repeat the question, too. You got the question?
Regarding the number of deaths on the West Bank in the African American community, we have identified that certainly that area of Jefferson Parish has a higher density of African Americans than the others. There's also some nursing homes in that zip code that may explain it, but we have noticed it. I mean, there's some pretty detailed data that went out yesterday, regarding that, and I'm not sure how else to address it.
Are you seeing any kind of trends with the deaths? I mean, parish-wide?
Parish-wide, it seems, again, your deaths are going to trail infections by probably 3 weeks of exposures by 3 weeks. And I do see it starting to go down a little bit. We're still seeing, the majority of the deaths we're seeing are, elderly people with comorbidities. Comorbidities being high blood pressure, diabetes, kidney failure, obesity, and lung disease.
Madam President, what are the consequences for non-essential and essential businesses that are not following the rules?
Right now? So right now, what we're asking, and I think we in Jefferson Parish, overwhelmingly, this was such a change in how we live. I want to say that our business community overwhelmingly has been supportive of this. It's been on rare occasions that we've had to have some calls behind the scenes to address that, and we've been doing that individually is how we've been handling it. I want to encourage, if anyone sees any activity that they just think is not appropriate for where we are as a community, to call 911. The Sheriff's Office has been very much willing to send out resources to that area to look at it. And but even leading up to this weekend, we were very concerned. I didn't really get any calls about a big crowd somewhere. So again, there is more traffic, and of course when I talked to you about the unicast social distancing, I think they use cell phone data. We have some work to do there, a D+, but sometimes I'll go into a store and I'll think it's too crowded, and I'll just call the manager the next day, and they're on top of it, and it's been rare cases. I've noticed that there's certainly more plexiglass there. There's more counting people that come in and out. So again, I think overwhelmingly in Jefferson Parish we have responded appropriately to it. Our business community has been very, very cooperative, and I haven't needed to do anything more than make a phone call and it gets resolved. And again, those incidences are kind of few and far between. Thank goodness for that. Any other questions?
Yes, ma'am.
Thank you.
From Channel 4. Where do residents report businesses that are not obeying the statewide order?
I'm sorry, I didn't.
Where do residences report businesses that are not obeying the statewide order? Do they call your office?
Well, they can call our offices. The council members will sometimes get constituents complaining, and they'll reach out to me. And of course, the sheriff has said call 911. I mean, there are definite rules in place. It's what's socially appropriate or what looks right, and then there are definitely, actual rules in place for this. The 10-person or more is actually, a law. So it's hard to set, any numbers. I mean, a lot of times different mayors will ask and call, or different, if it looks crowded, I say, a park, it should look like maybe a couple's walking and 1 or 2 people here. If you see like a social gathering, we need to break that up. We need to call 911. But for people, individuals getting exercise, that kind of thing, we want that to happen still, as long as it's appropriately minding the social distance rules that we have.
Yes, ma'am. And we received a complaint about specifically the Lakeview Country Club in Metairie, operating as normal with kids in the pool, people playing tennis, and up to a dozen cars in the parking lot every single day.
So if anyone sees anything appropriate, please reach out to my office, and we will work to make sure that gets addressed, okay? Thank you. Any other questions for any of us? We certainly appreciate all of you being here. We appreciate everything you're doing. We look forward, as we say, as time goes on, we'll be making different announcements, and we will start stepping into what we recall as our normal lives slowly. And so we all look forward to that day. So thank you so much.